Is Restylane a good option? I've always had deep tear troughs, but within the last year, I noticed I can no longer fully cover them with makeup. I have to apply more than I like, and I don't look fresh at all when not wearing any. I just look tired, even though I work out daily and get enough sleep. The volume has fallen, and the eyes, combined with marionette lines, are making me feel older than my age. Mostly I am concerned with the eyes, though, for now. I'm hesitant to do something permanent, but would like more feedback.
Thank you for your question. You submitted a photo and you stated in your question that your tear trough has always been deep and that recently you found that you can't cover it up as well with makeup. And you also mentioned that in combination with the marionette line that it certainly makes your face look older. Well, I can certainly assist you with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic surgeon certified by the American Board of Cosmetic Surgery and fellowship training through the American Society of Ophthalmic, Plastic, and Reconstructive Surgery, practicing in Manhattan and Long Island for over 20 years. Facial aging and rejuvenation of the eyes is a significant part of my daily practice, and I can certainly give you a lot of perspective on how I approach patients like yourself in my practice in Manhattan and Long Island. So to understand the tear trough area, I always tell our patients is that you can focus in on a single area of hollowness, but then you should always step back and take a look at the big picture. When I look at somebody, I don't just look at their eye area where there's a concern, but I also look at the eyelid-cheek junction, I look at the cheek structure, I look at the balance of the whole face. You see, the challenge is with facial aging is not just soft tissue loss at the eyelid area or in isolation, but there's also loss of bone, muscle, and fat. And that's where you see some of these lines, like the deepening of the nasolabial folds or the deepening of the marionette lines. So one of the common errors in this field, and I mean broadly in cosmetic surgery, cosmetic dermatology, is the chasing of lines. And certainly, thanks to fillers like Restylane, we're able to actually address some of these lines very aggressively because of its unique quality, which makes it soft and easy to work with. But what I find is when patients come to us who aren't satisfied with an injection in the tear trough done elsewhere, it's often not because of a technical issue of the way it was done, but rather the fact that they feel like they still don't look well rested. So you have to kind of understand what makes someone look well rested and youthful. And that takes us to a step back to what's referred to often as the golden ratio, the balance in the areas of the face so that a youthful, attractive face has some balance. So I would agree that the tear trough area can be treated with Restylane. We also address skin quality as a side note with something called platelet-rich plasma, where the Restylane is combined with platelet-rich plasma to help with not only the hollow, but also the skin quality. Platelet-rich plasma, briefly, is derived from your own blood and contains the healing growth factors that stimulate skin quality and improve color, and we find that synergy to be very effective. But I would say also in some patients, and since we don't have a full face photo of you, I would say that it might be worth learning about is we do something to augment the cheek, and not in the traditional way where you just add volume in the soft tissue, which is very common, but we actually do something called the Y-lift. And the Y-lift is a technique when you get down to it, of adding volume to the structural aspects of the face. You know, when I mentioned you lose bone, muscle, and fat, there's a deflation, there's a loss of volume. So a lot of times when we combine the tear trough with cheek augmentation or cheek lift, then the whole eye area looks so much better because it's in balance. It's in balance with the rest of the face, and now the face looks really good. So, you know, the whole is greater than the sum of the parts, and it's something worth considering as you learn about your options. The key is to just understand the physiology and the issues that you're dealing with. You know, for some people who look for this type of solution, they also happen to have puffy under eye bags, and if the under eye bags are too prominent, then it's not worth it to do Restylane alone. So although a two-dimensional photo is helpful, a three-dimensional examination is much more important and much more valuable. I think that the answer to your question is yes, Restylane is an option. I would also suggest adding the perspective of thinking of skin quality and thinking of volume that's more global to give you a more youthful, rested look. In addition to address the marionette lines, we also improved the jawline and the marionette lines with the Y-lift method. So that being said, I think you have a lot more research to do to get some ideas and then meet with qualified, experienced doctors who perform these procedures, and then try something and see how you like it. So I hope that was helpful. I wish you the best of luck, and thank you for your question.